This segment is sponsored by VCU Health.
The doctor is in and you have questions. Although the winter months offer opportunities for family and friends together to celebrate, we must keep in mind that COVID-19 spreads much more easily indoors. Dr. Gonzalo Behrman, infectious disease expert with VCU Health, is here to share that information on the Omicron variant and how we can reduce the risk of infection. Doctor, boy, talk about being timely. Good to see you, sir.
Absolutely. Pleasure to be back on the show with you.
All right, so we are seeing the Omicron variant in our community and the increase that comes with that. Can you explain a little bit about what exactly we're seeing?
What we're seeing is really an explosion of cases, not only in Virginia, but across the country. Even a couple of weeks ago, the Omicron variant was not the dominant strain of COVID in the community. Now it's become the dominant strain, which is highly transmissible and can cause infections in the unvaccinated and also breakthrough infections in the vaccinated.
Yeah, so highly transmissible was the key phrase in that one. Is that why we're seeing such a big spike right now?
Correct. The transmissibility, and also because of the gatherings and starting with the Thanksgiving season and this holiday season and Christmas and this coming weekend with New Year's, we anticipate ongoing transmission in the community.
So what can we do as individuals to kind of tamp things down and be safe?
Yeah, so first and foremost, if one is not vaccinated, now is the time to start the vaccine series. If one is eligible for a booster, absolutely positively proceed with a booster. But there are some other things that can be done. For example, limiting or even cutting out mass gatherings or gatherings beyond the family unit. If one must go to a gathering, certainly wear a mask. That's critically important. And if one is the host of a gathering, consider either requesting that the guests be vaccinated or to take a rapid test the day of or the day before the event to ensure that they're not sick.
Yeah, take a rapid test if we can find one is
Correct.
the key on that. All right, so to help clarify those folks on the fence, if you're having symptoms or you think you're having symptoms, the emergency room may pop into your brain. What should we do once we get to that part of this situation?
Well, I think it's first, we should say that it's difficult, nearly impossible actually to differentiate COVID-19 symptoms from that of the common cold or even that of an influenza-like illness. So if one is symptomatic at this time, assume that you have COVID-19 and take the precautions. If you can get a home test and you're not very sick, do that and isolate accordingly. Certainly reach out to the primary care provider for testing. And certainly if symptoms escalate, high fever, either muscle pain, body pain, shortness of breath, significant cough, chest pain, then go to urgent care or go to the emergency department.
I think everybody has their different read on what's serious and what's not. But if you're having symptoms that to me sound a lot like the flu, or maybe even a little milder, then you may be needing some help.
That is correct, particularly if there's shortness of breath associated with that. If the shortness of breath is getting worse rapidly over the course of hours or a day, certainly seek professional assistance, urgent care, primary care, or even emergency room.
All right. It's always good advice. We really appreciate you, and now, of course, is more important than ever. Thank you, Doctor. Always appreciate you coming in and visiting with us. For more information, folks, here's all you need to do. Visit vcuhealth.org. Virginia This Morning is going to return right after this.